I had a dentist call me and he said, just tell me what it is. A patient walked in my door and asked me to do it, and I don't even know what it is. And I thought, one, good for you for saying, hey, that's not true or doesn't exist. Thanks for picking up the phone. And once I walked him through it, he went, oh my gosh, and you can do that? You can actually do that?
Welcome to another episode of the 3 on 6 podcast with Dr. Randy Roberts.
Education, empowerment, starting now.
Welcome to the 3 on 6 podcast. I'm Dr. Randy Roberts, and I am super excited to announce our guest, Dr. Jason Emett, who is a shining star among our 3 on 6 providers. Ever since we've added him to our group, he's really elevated all of us. He's elevated the 3 on 6 as a brand. He's changing the lives of so many patients, and we are really excited to have him as one of our doctors. And that's why I wanted to bring him on and present him to you today so that we can talk and see how this experience has been for you since becoming a 3 on 6 provider.
I appreciate that. And first off, thanks for having me. I mean, what an honor to be on the same stage as Randy Roberts. This is a big deal. So thank you. So I came on board with 3 on 6 about 18 months ago, and it has just been the best thing I've ever done in my entire career. For me, my staff, and of course for our patients, it's just been amazing.
Yeah, and you've done something completely unique that none of our other 3 on 6 providers have done, and that is you're exclusively doing 3 on 6. You went from being a general dentist to just saying, you know what, I just want to do the thing that I feel like. Do you want to explain how you came to that decision and what's going for you?
I've always been a surgical-based dentist. I'm a general dentist. I love doing surgery. And for years, I did just wisdom teeth. And wisdom teeth were fine, but I didn't love it. I would see a patient once, and most of the time, I'd never see him again. And it just wasn't as fulfilling as I thought it would be. And so when I came across what you guys were doing with 3 on 6, I always knew I wanted to transition into doing full mouth rehab. And I knew all the other options out there. My background is I was a dental technician for a long time. I was familiar with these workflows, but nobody had it figured out. And then somebody said, no, I think the 3 on 6 guys know how to do this. I'm like, who are the 3 on 6 guys? I've never even heard of it. And once I came to know who you guys were, obviously I came to the training. It really resonated well with not only who I am as a practitioner, but I knew that this is something I could change the lives of people all over the place. And we've done that. We've helped patients from across the country. And so for me, it was a natural transition. I like doing surgery. 3 on 6 is surgical based. And it brought all the things I was looking for in my career, which is I like spending time with patients. I like getting to know patients. Now my patients come in the office and most of them run over and give me a big hug. It's just a totally different place to be in. So for me, it was a natural transition. And in my office, that's all we do. I don't do any general dentistry. I don't do anything else besides just the 3 on 6 procedure. And so my whole staff is geared towards that. Our office is set up for that. Everything we do, we eat, breathe, sleep, 3 on 6.
Yeah, so I made a video several years ago kind of about my frustrations of being a dentist, because pretty much everybody you talk to talks about they don't like the feel even of just walking into a dentist's office, they're scared. It's like they might not ever go because of that fear that they have of the dentist. And then you as the dentist are this person that you already are kind of losing that battle before they even walk into the door.
True.
So then they come in and then you do a filling, and let's say that somebody has a cavity on their tooth and then you do that filling. They potentially have some pain on that tooth afterwards, and you're just doing this little procedure, and I don't know, it's just, you're giving them a shot. There's all these different things of doing that, being a dentist that are stressful, because you don't like hurting people. You don't like it when people don't like you. You don't like all these things. Whereas with doing the 3 on 6, I feel like for my personal life, it has really made me feel better as a human and enjoy my life better. Instead of causing pain, I feel like I'm changing people's lives. And like, instead of having people like, I think you're a good dentist, that's like, I am a different person. Like I'm a new person, and we're so do you have a similar experience?
Oh yeah, patients walk in the door, they're like, you walk in and say, hey, I'm Dr. Emett, and they say, oh, I hate you. You don't even know me. I haven't met you. You just have had a bad experience with the dentist, and we just have this bad reputation. Dentists have a bad reputation of causing pain and an uncomfortable visit.
Yeah.
But it's totally the opposite end of the spectrum for me. My patients love me. I don't know. I hope you love me. I walk in the room and they're like, "Oh my gosh, it's so good to see you." And they're giving me hugs. And I can't even tell you how many patients show up and they're bringing my team treats and homemade things. And they're just so happy with what we've done for their lives. It's just a totally different thing. So if a patient, when I get to know them in the very beginning, says they've had a bad experience, they have dental phobia, I'm always so aware of that because it's very true. And that's one of the things that keeps people from going to the dentist in the first place. But it doesn't have to be that way, right? We can give them a totally different experience. So I let them know this is a judgment-free zone. Doesn't matter what you've been through to get to this point, but I love being in a position now where they just want to come see me. They're like excited to come back to the next appointment. They're excited for what's happening next.
It's such a paradigm shift for the industry.
Oh yeah.
You know, I talk to doctors on social media and they're like, what are you talking about? How you possibly going to do this? Whereas like patients, I feel like are oftentimes more educated than doctors these days.
Totally.
And it's like, they're having to go to their doctors and say, listen, the 3-on-6 is better than the LNX. Doctor, no, it's not. What are you talking about? That's a gimmick. That's not a real thing. It's like patients have access to all of the information now.
Yeah.
Like they can become better educated than doctors because they have access to all of the information that the doctors do too. And so often the doctors and dentists are locked in what they learned in dental school 20 years ago.
Right.
And they're not growing at the pace that
technology
is growing, right?
Yeah.
And the world. And as doctors are learning stuff, if you're averse to learning and growing as things are learning and growing, you're going to be way far behind.
Totally. I have so many dentists, people, friends of mine and colleagues who don't even know what it is. They don't even know the difference. And the patients all the time know more. They can go online and they get educated about what they want in their life. And I love when a patient comes to the door and they're like, "Oh, I know what 3-on-6 is. That's what I want." It's just access to information is so much different, but it totally is a paradigm shift for dentists to think, is this possible? You know, we're introduced to the concept of an FP1, but to get there was so challenging. The workflow, all the headache, the stuff you went through in the first iterations of 3-on-6, and all that's gone, right? It is such a smooth workflow. The patient experience is so wonderful, and it's totally achievable now, where just years ago it wasn't.
Yeah, I feel like there's a lot of doctors who are comparing the 3-on-6 to what other doctors have done with FP1. And they're like, look, this is what happens with FP1 over time. And I say to them, the 3-on-6 is not that.
Right.
We break it up into bridges. Most people, when they're doing FP1, they're leaving it in one big long piece. And so you're not going to get the bone stimulation and bone growth around your implants the way that we do.
Yeah.
You're going to get bone loss. You're going to get tissue loss. Those restorations have to be much thicker because they're one piece. So you're not going to get the same phonetics. And you're more likely to have things break still. Even though it's thicker, it's more likely to break. So with the 3-on-6 and with all the things that we've been able to develop and fine tune over the years, we're able to get results that they don't understand because they don't know what the 3-on-6 is.
That's right.
So it's just it's a learning curve. And a lot of people aren't willing to invest the time and effort to learn it. But the patients, they're going to research the crap out of everything until they can figure out what the best thing is for them. I have patients that have been researching this and everything else for like 5 years before they're like, you know what? I've been watching your videos. I've been researching this for 5 years, and now I'm finally going to pull the trigger and I'm going to make this happen. That's as long as it takes to get a bachelor's degree. They've got a bachelor's degree in figuring out what they want for their own mouth. And they've probably spent thousands of hours during those 5 years figuring it all out.
Yeah.
They could write a thesis on it probably.
Totally. We have patients all the time that come in and see us, and the amount of information they already know is shocking. They're using words that we didn't even learn in dental school. They're using, terminology and phrases that I'm like, how do you know what that is? But they can go out and join like the Facebook group page, the 3-on-6 Facebook page. They can do some research and they get all the support from other patients that have gone through the experience. And it's more of a community now, and it's just taking off like wildfire. The most recent training, for new 3-on-6 doctors. It's a room full of cutting-edge, forward-thinking doctors wanting to offer this to their patients. And it's exciting to see it grow when there's rooms full now of new doctors learning how to offer this treatment to their patients.
Right. Whereas traditionally, like you were saying, it was like, where can I find more doctors that are interested in doing this? And it was a hard battle. But now I feel like the patients are really the driving force now, because and the patients around the whole country and around the world, they're demanding it, even though we're not doing nationwide marketing. We're not doing worldwide marketing, but we have patients coming in from Denmark.
I was going to say, we were doing a podcast not that long ago, and somebody that was really active asking questions was in Europe somewhere.
Right.
And it's like, okay.
Or Australia. It seems like somebody from Australia.
Maybe it was Australia.
Yeah, because we've got people all around the world that are like, this is what we need, not because we're marketing to them, but because they're doing the research.
Good point.
And so anyways, it's an exciting time to be in the position where we're at. I feel like at the top of the industry for full mouth implant restorations, when it's becoming such a need for so many people.
Yeah, I had a dentist call me just about a month ago, and he said, just tell me what it is. A patient walked in my door and asked me to do it, and I don't even know what it is. And I thought, one, good for you for saying, hey, that's not true or doesn't exist. Thanks for picking up the phone. And once I walked him through it, he went, oh my gosh, and you can do that? You can actually do that? So he's sending me the patient to do the work, because he's like, I don't have the ability, I don't have the training right now to do it, but my patient wants it right now. But he didn't even know what it was. This guy's been practicing dentistry for 20 years.
Yeah.
And the patient went in and said, hey, I want this. And now the doctor's out there having to figure out what that even is. So
yeah,
you bring up a really good point.
Thank you. Well, is there anything else you want to talk about yourself and your practice that you've got down there?
My ego's small. I don't want to talk about myself.
You're also a trainer. Can you talk a little bit about that? Did you already?
Not necessarily. So I'm actually fortunate enough now that we've done a lot of work on 3-on-6 patients, that I got to come up to the Salt Lake office and help train the next group of up and coming 3-on-6 doctors. And that's super fun. I can see the in their eyes when they get here, there's a lot. I mean, going through the 3-on-6 training, it's intense and there's a lot to learn. There's a lot to do, but it's so nice to just be joining this big group of doctors already doing it. And it's just an honor to be in a position where I can help them on that journey to get from, I know my patients want something better. I know I could do something better. And how do I do it? And it's just fun to kind of watch them learn and grow through that process and realize I can take this home and do this in my community right now and give patients a 3-on-6. So that's been really fun.
Yeah. There's so many fears and apprehensions that patients will have, which is why they'll take 5 years and they'll do thousands of hours of research. And you do a great job of helping break down those walls and those barriers with your patients to be able to help them get over that, which is, we really appreciate you helping share those things with our doctors here.
Oh, absolutely.
And so you've also been training at another institute as well.
Yeah, so I'm a faculty mentor at Colorado Surgical Institute, and I just teach atraumatic extractions, mostly wisdom teeth.
Yeah, okay.
Yeah.
So atraumatic extractions is one of the most important parts of the 3-on-6.
That's a good point. That's true.
So because like most of the other surgeries that you get, it's okay to break bone while you're pulling out the teeth.
Mm-hmm.
And with the 3-on-6, that is not okay. We want to make sure that we're not pulling out your bone. We're only pulling out your teeth. And that can be difficult. And you have to have some finesse, and it takes skills, and it takes more time. Some patients are like, well, why does it take longer to get a 3-on-6? Like when I can get an all-on-4 so much quicker. And it's like, well, the 3-on-6 requires more finesse. It requires more time to be able to surgically remove these teeth,
Right.
One at a time. And do you want your bone to be broken out with your teeth when they do these restorations? Probably not.
Yeah.
You'd probably rather try and keep all that bone as healthy and strong as possible, and it takes more time. And then also getting the implants placed perfectly, because with the All-on-X, you don't have to have precisely placed implants. You just have to find strong bone, and you're gonna have a big old restoration in there. So your margin of error can be 30 degrees, could be like an inch. Whereas with the 3-on-6, your margin of error, you've got like a millimeter on both sides.
Yeah.
So it has to be perfectly planned, and those extractions have to be done very, very well. And you've been able to come on and you've been able to show us that you're really good at what you do and your patients. And I see you on social media all the time making awesome videos that are funny and engaging. So I like seeing your social media as well.
Well, thanks. It's been a lot of fun. It's interesting to take these skills that kind of got developed in different ways and find out why and bring it all together, because it is a whole suite of ability, right? H-medic extractions, proper implant placement, managing the soft tissue, all of these things you have to know how to do to get to that end result and actually deliver the quality 3-on-6 restoration they're looking for. So this is not just a simple thing. It is pretty technique sensitive, and the right dentist with the right training can totally do it, but it does take some special training and some special education to get there.
Traditionally, it would have been an oral surgeon placing the implants. It would have been a prosthodontist doing the teeth. It would have been a periodontist doing the gum tissue modeling. And so you can't have 3 people doing this all. You have to have one person that knows how to be an expert in all of those things. So with our trainings, we have to make sure that our doctors, and right now we've got oral surgeons here. We've got a periodontist here. We've got a prosthodontist that we've had to train. So we have to train all of the specialists to be able to learn all of the different aspects of this to be able to get this whole treatment, because it requires all of the specialties to be able to get the perfect outcome, because your perfect outcome requires the perfect teeth, the perfect gums, and the perfect bone. Got 3 specialties all merged into one with the 3-on-6.
Yeah.
And so that's why it requires special training coming to become a 3-on-6 provider. We've invested millions of dollars into our processes to make sure that they're the best, that they're top notch. And we're constantly on the cutting edge of making sure that it is the best. Whenever there's new pieces of technology that come out, that are coming out all the time, new implants, new everything, to try and make sure that whatever is available that is going to improve the experience for our patients and the outcomes and the long-term outcome, that it's going to get incorporated into our procedures.
And that's one of the things you can trust with associating with the 3-on-6 brand, is there's this whole team back there going through the iterations, trying all the new technology, and only bringing forward the things that make it better for the patients, better for the doctor, better for the surgery. And so when you find a 3-on-6 provider, you can trust that they have the training. Not only do they get it once, we have annual training, we have continued training, but they have the continued daily support of the entire network now of all the 3-on-6 providers. So you really have a bar that's set really, really high. So when you find a 3-on-6 provider and they can say, "Hi, I'm a licensed, authorized 3-on-6 provider," you can trust that that person has the skill set and the training necessary to give you the results that you see from all these other patients, right? All over the social media for 3-on-6, the videos that we're making, you can trust that when you see this brand, when you see 3-on-6, you're getting that product for yourself.
So there's a lot of patients right now who see the 3-on-6 and they say, "I want that. I'm just going to go talk to my doctor who doesn't do the 3-on-6s and ask them if they can do that." What would you say to that patient that is talking to that doctor?
Here's the thing. There's no doubt in my mind that their doctor can do the 3-on-6 once they've come through the training. We have, like you mentioned, oral surgeons and specialists and really talented super GPs who sit back during these trainings and have major aha moments the entire time. It's not outside of their scope, but you can't get the 3-on-6 result from a non-licensed 3-on-6 provider because they just don't know what they don't know. I'm sure that that doctor is a very talented doctor, but they just don't know what they don't know. And they need to find out how we manage the soft tissue and how we get the implants in the right place and how we get them to get that final result that every patient's looking for. And it's pretty technique sensitive.
Right.
So coming and getting the training makes all the difference.
Yeah. And our lab has done these thousands of times.
Oh,
and this
the
doctor,
lab is so good.
the doctor is going to send it to a lab that has probably never done one.
Right.
And they're like, "Hey, I want you to do this." And the lab's going to say, "Okay, we'll try and figure that out for you." And do you want a doctor figuring it out and a lab that's figuring it out, or a doctor
For their
that's
first
trained?
time or even their 10th time? No
Right.
way. I'm going to call myself out here for this. I'm going to go on blast, but my family owns a pretty big dental lab and they've been in the dental lab technology business for a long time. And I send all of my cases to the 3-on-6 lab because it's a whole separate language. I want to communicate with a lab who does this all day long, day in and day out. This is what they do. And that's what you get with 3-on-6. So we're able to quickly solve challenges that a normal dental lab who doesn't do this normally may not even be able to solve in a reasonable time frame. So there's a big component to the lab as well. So I have a huge shout out to the lab, by the way. Your guys' lab is so good. I love the lab.
Thank you.
It's really important.
Yeah, we have a patient right now that was told she was getting a 3-on-6
I've heard of these.
that's here for the training right now. and she got not anything near what a 3-on-6 is, which is really sad. So we're having to fix her restoration that she got. And it's definitely easier to get it done correctly the first time than it is to
These revisions are really tough.
have somebody to try and fix it after somebody has messed it up. Because like I said, once somebody tries to pull those teeth out and breaks away that bone, it makes the restoration so much more difficult just with that. If they've done it multiple times across their whole mouth, and then also if they don't do all of the other steps that are really important, which is why we're spending a week training all of these doctors.
Right.
Then they're not using our lab, which is going to help them through the entire process from start to finish. The likelihood of success decreases significantly.
Yeah, I totally agree. I have a patient in my own practice, very similar. They went to somewhere thinking they were getting this, and they actually woke up with a denture. They were never even told that was an option. And they were told by the provider, oh, well, that's just what we had to do because you didn't have the right bone or didn't have the right thing. And they just stuck with it for a year and ended up with a less than ideal restoration when they thought they were getting like the 3-on-6. And we corrected it. It took us over a year to get it, but it was sure challenging. It was sure a lot of work.
Yeah.
So it's definitely better to get it done the right way the first time. A lot easier.
Yeah. Well, thank you so much for coming on to the podcast.
Oh, of course. This was great.
A 3-on-6 provider. You've been a pleasure to be associated with and to be partnered with in the organization. So thank you so much for coming on.
It's just been an honor to be here and be associated with you guys. It's amazing.
All right. And thank you for coming. We'll see you next time.
If you're considering restorative dentistry with dental implants, you should know all of your options. Head to 3on6.com and book a free consultation with a 3-on-6 provider near you. If you enjoyed this content, please like, subscribe, share, or leave a review in the comments. Until next time, keep smiling.